Hi friends, Ruth Werner here to talk about my current absolute favorite online self-paced continuing education class, and bonus, it is NCB-TMB approved for ethics credit too. It's called A Doctor's Note is Not Good Enough and What is Better. And in this Fun for All, we go through why we think doctors' notes matter. Spoiler alert, they don't do what you think they might do. And we talk about how to set up lines of communication that will get you what you really need, information to help you make good clinical decisions. Please join me for A Doctor's Note is Not Good Enough and What is Better. You can do it anytime that works for you and anywhere you have Wi-Fi. Visit me at ruthwerner.com to register today.
Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Dear listeners, today I have a really special surprise for you, and it has to do with the letter that we got. The surprise is a visit from the person who knows more about scar tissue than anyone else I know, and that is my dear friend from British Columbia, Cathy Ryan. Cathy, would you introduce yourself, please?
Ruth, thank you so much for your kind words. I don't know if I'm the person who knows the most about scar tissues, but I would call myself a massage therapist who's scar tissue informed.
Scar tissue informed. Scar tissue informed that you wrote a book. What's your book called?
The title of the book is Traumatic Scar Tissue Management, Massage Therapy Principles, Practice, and Protocols. And I co-authored this book with my dear friend and colleague, Nancy Kinney-Smith.
Wonderful. Wonderful. And I'm just so glad that you could join me today for this. So here's the letter that we got. And I read this letter and I thought, well, I could do this episode on my own, but why work that hard when Cathy Ryan might answer a phone call? So here we are. Our story goes like this. Hi, Ruth. I have a question specific to Marfan syndrome and addressing scar tissue from a traumatic near amputation accident. Lots of reconstruction, skin grafts, and ensuing edema. I've asked a number of therapists and massage therapy teachers in my area if they have come across Marfan with any of their patients, have had no luck so far. I remember when I went to massage school many years ago, there were some contraindications related to massage and Marfan's, but I can't recall exactly what they were and if those are still applicable today or if research has proved otherwise. My main question is, because Marfan's is a connective tissue disorder, can a therapist safely challenge the scar tissue from the surgery without negatively impacting the tissue integrity? Or is it more about how their Marfan presents and what the individual responses to treatment are? Should I proceed with gentle challenges at first, monitor tissue and patient reaction, and increase tissue challenges accordingly? Would this be a safe approach? Or is scar tissue and connective tissue work a contraindication? Or are there other considerations I'm not even thinking about? This individual's tissue has already undergone extensive trauma from the accident. They've healed fairly well. Tissue integrity is good beyond the surgical scars and the accumulation of distal edema. Would the amount of trauma to the area and how it's healed be an indication to how much one could challenge the tissue? If you're able to offer any insight or point me in another direction, I would be so grateful. Well, contributor, it is your lucky day because I am now going to punt this question on a person who has both had a recent severe trauma with a near amputation and who has this connective tissue disorder called Marfan syndrome. Cathy, what do you think?
Well, for starters, when Ruth Warner calls, you answer. I'll just start out by saying that. So, of course, I answered. And because we're going to be talking about scars and connective tissue, I'm going to answer that too. Because, as you know, that is certainly one of my areas of practice focus and has been for quite some time. I think for me, in that question I think first we have to define the word, is it safe to challenge the tissue? And I think we need to define what we mean by challenge the tissue. So just for starters, with connective tissue disorders like Marfan's, which shows some similarities to the hypermobility syndromes like Ehlers-Danlos, where laxity is a concern. So if we're talking about challenging the tissue from a stretch perspective, that's something that may not serve the patient well.
With Ehlers-Danlos, I think about we don't want to stretch the joints beyond a healthy range of motion. But I'm wondering if this contributor is talking about stretching the scar tissue around the surgical scars.
Yeah. And again, I think we need to be mindful about when we're talking about tensioning or stretching tissue, in both of those contexts. And certainly it's an area of research that, from my perspective, still needs to be fleshed out. I'll give an example. So Dr. Tina Wang, who presented at the last Fascia Congress, was presenting on Ehlers-Danlos. And in that study, one of the things they found is that although there is a laxity issue with the connective tissue, at the same time, there's an issue with what I would describe as mouth sliding. So in order for us to achieve movement, it's not just about muscles lengthening across the, joint lever, but, various collagen fibers and layers of tissue needs to slide in reference to one another in order for us to be able to achieve, the kind of functionality that we're looking for from our soft tissues, various types of soft tissues. So, I would say that because there are some similarities that might be of this context with Ehlers-Danlos and Marfan's, my focus would be to see if I could have some kind of positive impact on that loose connective tissue that serves the sliding function versus just trying to challenge tissue from a stretch perspective.
So it sounds like you're first of all, we're going to apply the model of Ehlers-Danlos, which we know a little bit more about, to Marfan's because they're quite similar in terms of how the collagen doesn't function the way we would like it to do. Right? That seems perfectly fair. So let me play the part of our contributor and say, all right, so I have this client and they've had a number of surgeries on their arm or their leg or whatever it is that had the trauma. They're feeling like that scar tissue is constricted and really interfering in their range of motion. They use the word challenge. I'm not 100% sure how what you just described is different from the word challenge. is it, first of all, what I'm hearing is it probably we can get to yes, right? Probably we can find a way to work with this person on their goals of improving a sense of mobility around this traumatized area that just had surgeries. Yes?
Yes.
Okay, so we're not calling Marfan's a systemic contraindication.
Yeah. So from my perspective, I would not consider the connective tissue disorders a total contraindication, like point blank.
Right. No, I agree with you completely. And that, answers one of the questions that our contributor gave us. So how would you describe your approach to this in terms other than challenging the scar tissue?
Well, I think those who know me know that if you really want to rile me up, you'll use terms like breaking up or breaking down scar tissue. So when someone says challenge the tissue, and my reason for that for me is because we will attempt to do with our hands what the words imply. That is my issue, the imprecise language. So we know from current research that it is physiologically impossible to break up what we would consider mature scar tissue, because we're talking about mature collagen. It's pretty tough stuff. And don't take my word for it. Go check out Gil Headley's, some of his video clips, where he's excised a chunk of what would be loose connective tissue type. So this is the fine stuff, not the dense, hardier stuff like IT band or something of that nature. And he attaches weight to it and holds it up, and the tissue doesn't budge. So that lets you know just how tough this stuff is. So the concept that we can actually rip this apart with our hands, both physiologically makes most sense, and I think from a patient perspective is potentially counterproductive to what we would want to try to do. So when I talk about having an impact on the loose connective tissue that serves a sliding function, I'm coming more from less of a perspective of thinking about the fibers per se, and more of a perspective of thinking about the fluid environment in and around the collagen fibers, so that, that viscosity shift that Stecco talks about that we can achieve with our hands, which creates a more pliable collagen fiber and a better environment for sliding. So, and we know that from Stecco's research that shearing types of techniques are more productive.
Okay, well, that's a little difficult for me to envision, and this is just an audio podcast.
Yes.
I come from a background where shearing and tensioning feels a little bit like the same thing. Can you make a word picture that will help to discriminate between those two things?
Well, in tensioning or lengthening of tissue is more of a push and static hold, where shearing engages the tissue in a way that moves one layer across another layer back and forth. Almost more of like an oscillatory type of thing. Yes. And then, when you think about it physiologically, this is what happens in our joints, is this shearing as things glide or move past each other, which is what stimulates release of hyaluronan, which has an impact on the viscosity of the fluid environment. My understanding of Stecco's very complex research.
Yes. Well, and a lot of our listeners won't be familiar with the Stecco fascia research, but I will put in some links in our show notes. So I was actually going to congratulate our contributor on their language, because they didn't talk about breaking up connective tissue, but they did seem to talk about improving the quality of the tissue rather than breaking up the scar tissue, which was sort of the paradigm that I grew up with.
Me too.
In learning about orthopedic injuries.
Well, and I will just note that if we're coming from a perspective of improving the viscosity of the fluid environment, that does not pose the kind of risk that, say, a more forceful challenge or stretch or tension of tissue. So from my perspective, that's what would make that approach more appropriate for someone with connective tissue types of disorders. And that's the approach that I have used in my practice and have had good results.
I'm going to read this short paragraph where our writer our contributor describes a strategy, and we might tweak it just a bit. So they say, is it more about how their Marfan presents and what the individual responses to treatment are? To proceed with gentle challenges at first, monitor the tissue and patient reaction, and increase tissue challenges accordingly. Would this be a safe approach? So now I see why you really caught on to that word challenge, and we would like to maybe replace it with focus on improving the fluid viscosity around this area where things are probably a little stagnant and not moving well.
Yes.
You want to add to that?
Yeah, I think that's, that is an excellent, synopsis of the perspective that I'm coming from, is that we want that tissue to be more pliable and have a better capacity to slide in reference to, individual strands next to each other or layers of tissue, adjacent to one another, rather than just trying to challenge it from a tensioning or stretch perspective to achieve the kind of movement that maybe the person needs to get to be able to restore function in the way that they're hoping for. In my practice, my work is in two parts. Part of it is post-surgical massage therapy, and then the other part is scar tissue management. So understanding the various stages of wound healing, really, really critical to how I'm using my hands. So for example, in the first month, I'm not necessarily doing scar tissue work because the collagen hasn't remodeled at that point. So my work is more about management of volumes of fluid in a contained space and keeping the nervous system calm. I really don't start any direct, what I would call scar tissue work, and probably till about 4 to 6 weeks out.
That's great. That's really awesome. Cathy, thank you so much for bringing your unique perspective and nuance into this discussion. I do want to emphasize, and this is something we spoke briefly about before I hit record, that people who have Marfan syndrome are not strangers to surgery. This is a connective tissue disorder that can cause a lot of different kinds of problems, including things like aneurysms and other issues. And so it's not at all unusual that someone with Marfan's will have had gone through surgery and had accumulations of scar tissue, which may or may not, be highly functional. Cathy, where can our listeners spend more time with you?
Well, as you know, I hang out with Heal Well quite a bit.
I'll put it in the show notes.
And my dear friends at Heal Well do sponsor my courses in the U.S. I'm usually in the U.S. 2 or 3 times a year, teaching through Heal Well. So anyone in the U.S. that's maybe interested in the scar tissue course that I teach, if they go to the Heal Well website, that's where you can find information about that. The other way that people can chat with me is to email me, and I'm happy to share my email address.
Oh, that is a very generous offer, and I will put it in the show notes. Thank you very much. Cathy,
Sure.
do you have a scar tissue course in the ABMP library at this point? I thought you did.
Actually, Nancy and I have a 3-part scar tissue course in the ABMP library. Thank you very much for that. As well, I have an Exploring Fascia, which is all about this, fascia science as I understand it, a 5-part series available online through Heal Well.
Wonderful. These are great resources. I'm so grateful that you responded to my invitation. And I think this is going to be really, really helpful for a lot of our listeners, not just around working with people who have Marfans, but people who have scars, which is most of us. So, all right. Well, that's going to wrap it up for us for today. Thanks again, Cathy. Really, really appreciate your taking the time.
Oh, my pleasure, Ruth. Anytime.
All right. Take care.